Orthopedic Surgeon. So I started off, I graduated from Ephrata High School in 1998. I went to medical school after going to Drexel University of Philadelphia. When I completed that, I did a orthopedic residency in Albany, New York. The orthopedic residency is 5 years, so all the surgery specialties are at least 5 years, neurosurgery, urology, 6. And after that, I chose to do a sports medicine fellowship. I did that in San Antonio, Texas. My practice is basically dealing with shoulder, hip, knee, construction, fixing things that are broken. It's kind of what you can think of an orthopedist doing. That's the surgical part of it. As a sports medicine specialist, I see it more as what everybody else on the stage has said so far is trying to find a way to get athletes, whether they're kids or professionals or collegiate athletes, back doing what they love doing. And hopefully it's doing it without me actually having to operate on it. And that's where I utilize the athletic trainers, the chiropractors, the physical therapists. They play a huge role in my practice in trying to treat people to make them better, get them back to what they need to do without me having to fix something. Unfortunately, there's things that happen along the way that need to get fixed. And when I do that, that's where the therapists come in to help guide the patient back to the best function that they can have. So sports medicine for me, the best part about it is it's just the same way as when I was playing baseball or soccer growing up. It's a team. It's a team. It's a group of people working together for a common goal. And I can't function in my job without them working and helping me. So the things I do, the things I enjoy doing most are ACL reconstructions. Those are the things you hear most about. Shoulder instability, so fixing things torn in the shoulder, the rotator cuff, taking care of throwing athletes. And that comes along with my affiliation with the Barnstormers. I also take care of Ephrata High School and Gardensville High School, so I get to see a lot of their football players and wrestlers. It's just the best part of my day is when we get done and people are back playing. I can see you go through what you want to do. But it's a long road to get there. If you count it, that's probably, I think it's 10 years out of my life, just school after high school. So I haven't been doing it as long as some of the people on stage, just because I haven't got enough gray hairs to do it. That's my heart when I do it.
I wish I had the gray hairs. My name is Quigley, the athletic trainer at Manheim Township. I've been at Manheim Township for 27 years. I've been a nationally certified athletic trainer for 33. I have an undergraduate degree from Pettay University and a master's degree at James Madison, and been working at the secondary level for 31 years. I spent a couple of years at collegiate level, thought I would give high school a try, and haven't left. It's one of the great joys in my life that I found my niche, found it early, and have stuck with it. Athletic trainers are the first line to see athletic injuries. As Dr. Hoyne said, it is a team effort. Sports medicine is a team, no matter how you slice it. We can't do our jobs independently, we have to all work together. Athletic trainers see injuries first. If you look at it in a prevention, treatment, recognition, rehab, that's what we do with athletic injuries. If it's beyond us, we obviously, in the best interest of the athletes, move to somebody else. Okay. That's one of the neat things with athletic training, is you never know what you're going to see. It's never dull, especially at the high school level. And it just, to quote what some of my colleagues have said, it's just fun. Okay. Athletic training is at least a 4-year degree. The profession is making a move now to master's level, which will be phased in the next couple of years. So you're looking at 5 to 6 years of school, and that allows you to sit for a national certification test. You have to pass the test in order to practice athletic training. Depending on where you work, 48 states have licensure, which means you have to be licensed by a regulatory board in that state. I am licensed by the State Board of Medicine and the State Board of Osteopathic Medicine here in Pennsylvania. There are approximately 20 accredited programs in the state of Pennsylvania for athletic training. So there's about 20 colleges, universities that you can look at just in this state if you want to get in it, if you want to pursue that type of education. There's approximately 300 across the country. So if you feel an itch to go to, the University of Hawaii, you can go there. Okay, which on a cold day sounds like a good idea. Athletic training, when I first started, it was what we call the traditional settings. You had pro teams, colleges, and high schools. Now, athletic trainers are emerging into doctors' offices, hospitals, industry, military. There's a big push in the military to hire athletic trainers. Performing arts. The Rockettes have a staff of 8 athletic trainers. So if you have a background in dance and want to do medicine, maybe that's something. NASCAR, rodeo. It's growing as Dr. Vollmar said, the science is growing, and we can prove more. It's not just anecdotal. Okay. So if you're interested in athletic training, there is a place that you can find yourself working, and it's not just a school setting.
Good morning, my name is Lyn Longenecker. My representation here is slightly different from these other gentlemen. They're presenting regarding their specific disciplines. I'm here representing the Pennsylvania College of Health Sciences and some of the opportunities that might be available for you as far as supportive roles within the healthcare industry. We offer a lot of different programs. Some of them would be sports medicine related, some of them on the periphery, some of them not as much, to be very frank. What I have provided for each of you at the table over here is a nice little outline of the different programs that we offer. I'm not going to go over each one of them. I would maybe like to highlight a couple of them to maybe fit in with the sports medicine type of the genre, and maybe kind of let you explore the rest. Sometimes students are making decisions about their career based on what they're familiar with, and my intent today is to make you aware of the different opportunities available. Some of them you may not have been aware of. We recently have moved. I don't know if any of you knew that. We were previously Lancaster General College of Nursing and Health Sciences. We've changed our name. We've also relocated. We are at 850 Greenfield Road, down from the Costco about half a mile. If any of you are familiar with that, I'm sure you are. Our administrative staff is there currently, and we are moving our students there in the fall of 16. As I said, what I'd like to do is maybe just touch on a couple of programs that we offer that might be a little more related here. I will suggest to you that a lot of them, at least on some level, would be involved in the healthcare industry. They're fairly obviously, but some of them might have also to do with these gentlemen. We are often the next step, I believe, after the athletic trainers for some of our programs, and that would be to, once they say, okay, yes, there is a problem that you need to get looked at, and in that case, we might be the next step for some of the imaging. We offer radiography, or more commonly there's x-ray. We offer diagnostic medical sonography. We offer nuclear medicine technology, all imaging areas. We offer nursing and respiratory care, respiratory dealing with impaired lung function, whether it be chronic conditions. I'm sure some athletes, maybe exercise-induced asthma, that type of thing, are problems. I know that I experience some of that type of thing when I'm going out early in the spring. I do have some asthma issues, nothing too serious. We also support the surgeons. We have a surgical technology program at the college. And as was mentioned earlier, a lot of these areas are becoming more common in some of the more peripheral areas. We have the surgery centers. It used to be that surgeries were done in hospitals. That's no longer the case only. So there's different areas that you can work. There's different outpatient clinics for imaging specialties as well. Most of our programs are going to be 2-year to begin. They begin at the associate degree level. You specifically go into a curriculum that is going to lead to your knowledge base in a particular area. You're going to need to become certified in those areas. There are exams that are taken to make sure you are qualified to do the job. We also offer the bachelor's degrees for your career progression opportunities and also the master's. Most of our careers are going to begin at the $40,000 to $45,000 per year range, and that's after 2 years, which is, depending on what your aspirations are, that's not really too shabby. And then through your experience, through additional education, you can certainly bump up those salaries. We are looking for students who really like sciences. It's kind of interesting to me sometimes when I talk to students at college fairs, and I kind of dig in a little bit and I ask them if they like science, and some of them are talking to me and they're going to become physicians, that kind of thing, and I ask them if they like science, and they really don't care for it. And I would suggest that most of the gentlemen up here would suggest that you're going to be doing a significant amount of physical sciences. So those are some skills that you're going to have. I'm hearing some chuckles up here because I'm sure they're harkening back to the days of the education process for them. And it's a continuous education process. There's new procedures being done. There's new things that we're learning and new ways to address certain conditions. Some things I'm sure that took many days and maybe even some weeks and months to recover from are now a much shorter recovery process with the assistance of these professionals here. So I just want you to keep us in mind as far as some career opportunities for you, and we welcome the opportunity to talk to you at some later point as well.